every day and in every way. Enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.
Imagine a world where diseases like measles, polio, and tetanus are a thing of the past. Routine immunizations makes this vision a reality. But despite its importance, many communities still face challenges in accessing these life-saving vaccines. A significant number of children, 14.5 million globally, remain unvaccinated, highlighting a need for improvement. Routine immunization refers to the regular administration of vaccines to individuals, typically infants and children, as part of a standard health system. It aims to protect individuals from preventable diseases by building immunity against specific pathogens. In Nigeria, like everywhere else, routine immunization plays a crucial role in public health, ensuring that children receive recommended vaccines at appropriate intervals. Joining me today is an expert, and we'll be discussing routine immunization on your favorite health TV talk show, The Physicians. Do stay tuned.
Every day and in every way. Enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.
It's another wonderful day on your favorite health TV talk show, The Physicians, where your health is our business. My name is Dr. Temitayo, and today we'll be talking about routine immunization. With me to take this very important topic is no other person than the beautiful Amazon, Dr. Temitayo Ishola, the head of Pediatric Department, EBUTE-META General Hospital. She's also a public health physician and a great member of the Medical Women's Association of Nigeria, Lagos State Branch. Dr. Ishola, you're welcome.
Thank you for having me.
I didn't get the memo because you came with the Nigerian color. Is there something green in my heart? Nothing green.
Nothing green.
Next time, I will make sure we are twinning.
Okay.
A little green. But
thank you.
Green with envy, I'm not going to envy you. But I know you're going to pour out your mind when it comes to this topic because it's something I know personally you are very passionate about. So we're talking about routine immunization.
Okay.
And in commemoration of the World Immunization Week, we want Nigerians to understand that immunization is not, something that is on a wish list. Let me just get immunized. It's a very powerful part of the healthcare system that we do know now that some people were vaccinated, but they did not get immunized. They are two different because you get the vaccination, but did you really even get immunized at the end of the day? But let's deep dive into this topic. What are the benefits of routine immunization?
Okay, Dr. May, thank you for having me. I'll start by saying the Nigerian government, the Lagos State government have done a lot to make sure that every child is well vaccinated and immunized. Like you rightly said, we can be vaccinated but not immunized. The benefit of immunization it's a lot, and it starts from the fact that it prevents infections, it prevents life-threatening diseases, and it makes our children to be healthy and to stay out of illness and be strong. And it also helps them to be able to assimilate, be out of illness, be able to attend to their school activities, be able to be healthy, and also save the family from having to spend money unnecessarily on infections that are preventable with the vaccines.
With the vaccines. Yes. So when we talk about now the benefits and all that, what if on the flip side, if people don't get vaccinated, what are the consequences of people not, especially children, because we are talking about routine immunization now. We are not talking about just any immunization, because you and I know that for adults, we also have some certain things that we'll get. For example, want to do cervical cancer screening.
Yes.
Once the result comes out, you start taking the different, but that is not what we are focused on. It's the routine immunization. And so this is really related to children.
Yes.
What are the consequences if they don't get immunized?
The routine immunization is for children between 1 and 59 months. That's under 5 mainly. Okay. But the recent one that has been introduced is the HPV vaccine, which is for 9 to 14 years old for girls. So for someone who is not vaccinated, there are a lot of consequences. We start from birth. At birth, we have like 3 vaccines that are meant to prevent some illnesses. We have the BCG, we have the HPV, and we have the polio. So those 3 are meant to prevent serious life-threatening illnesses. Such as the BCG is for tuberculosis, the HPV vaccine is for hepatitis B, which is life-threatening, and the polio is for poliomyelitis. And any child who comes down with polio would definitely have debilitating illness, which will prevent the child from walking, and so many other things that can come with it. So at 6 weeks, we have the ones that can prevent, like the rotavirus. The rotavirus it will prevent a child from having recurrent diseases, diarrhea diseases, because rotavirus has been found to be the commonest cause of diarrhea in children. Then we have the PCV, which is the pneumococcal conjugate vaccine, which helps to prevent pneumococcal diseases in children. Then we have the one of the HIV, that's Haemophilus influenza, bacterial infection. It prevents them from having all these diseases like meningitis, pneumonia, otitis media, sinusitis, which a child who does not get such vaccine will most likely come down with all these diseases that I've mentioned. So they are there to prevent them from having all these life-threatening diseases, and then for us to have a good life. So consequences of not having it it's enormous, and it is advisable that every child should be vaccinated and properly immunized.
So it's good that we talked about at birth and at 6 months, because one very important question people are going to, what are even this routine immunization? Because we talked about the benefit, the consequences, but I can hear someone saying, what is it about routine immunization? What are they in stages? I know we talked about the one at birth, that is the BCG, HPV, and the oral polio. And then at 6 weeks, we talk about the rotavirus, pneumococcal,
PCV 13,
exactly.
That's the pneumococcal vaccine, and then the HIV.
Exactly.
Yes, and at 6 weeks, we also give the penta. And that penta contains 5 different types of vaccine: the diphtheria, the pertussis, the tetanus. Then we have the HBV, which will now be the second dose of the HBV that was taken at birth, and then the polio.
So after 6 weeks, what are
the next time is 10 weeks. It's 10 weeks, like 4 weeks.
Okay, every 4 weeks.
4 weeks. It's a comprehensive plan that has been done by the Primary Health Care Board to make sure that those vaccines are given at specific ages. Because we discovered that at that point, those times are the times that children are at risk of getting those infections, and the rate of the severity at those points are usually very, very bad. So they are taken at stages. Then the fact that the child can also get relief from the first one that has been given, then they will have been able to get the appropriate antibodies and antigen that will have worked in the body for the well-immunized aspect of the vaccination. So before the next one is being taken. So after the first one is at birth, then we have 6 weeks, we have at 10 weeks, we have at 14 weeks, then 9 months. The 9 months is for measles and yellow fever. Then we have vitamin A, which is given every six months. Okay. Then sometimes, depending on the location, they can get at 2 years, they can get at 3 years, then the one of 9 to 14 years for every girl child. But
the boys have not been incorporated.
They've not been incorporated, but we are working on it. Because as it prevents, as the HPV, which is good for girls, is also good for boys. Because it prevents cancers in girls and so also in boys. Yes.
So, but now they've introduced the malaria vaccine, and we know it's not yet nationwide.
It's not.
Why was it specific to these particular zones that they chose now?
They chose those parts because of our looking at the hygiene and especially the environmental hygiene of those areas. The breeding for mosquito is high in those areas. So that was why they chose those specific areas to start as pilot and see how it is effective and efficient before they can spread it. It is actually.
We are really hoping that we're able to cover the whole nation.
Hopefully.
With time.
Every day and in every way, enjoy that I find support. No matter the role you play, you jump back supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.
Back here in the studio with me is no other person than Dr. Temitayo Ishola, and she has been telling us about the different immunization as age appropriate. From birth, there are certain types, then of course at 6 weeks, then after 6 weeks, 10 weeks, after 10 weeks, 14 weeks, then after 14 weeks, then in 9 months, then of course there are some they take at 2 years, 3 years. Recently added is the malaria vaccine. It is not yet covered nationwide, but of course a pilot study is currently going on now where these different malaria vaccines are being given to children. And for girls between the ages of 9 to 14, we are also focusing on giving them this vaccine to eradicate, if possible, the cervical cancer. So now, Dr. Ishola, this group of people that are very pivotal in the immunization, they are the ones that always we carry the box, we see them going from house to house and all that. What is the role of community health workers in promoting this routine immunization? Because there are mainly, most of them, community health extension workers, the nurses. You don't get to see doctors there. What is that their role? How important and pivotal is that role?
That role is very important because they are closer to the community. They are able to disseminate information and they are able to inform the community of what is trending and to be able to change that misinformation and then the cultural beliefs that are myths that some community members have against immunization. Because we've seen cases of mothers coming to the hospital and a 6 or 9 month old child have not had any immunization.
In this
day and age. Wow. And they'll tell you, because I don't want it, because I heard that somebody somewhere or something happened. And those are the things that the community health workers handle. So they are able to, and they are the ones that are in charge of immunization mostly. So they are able to give information, enlighten the community, inform them of the rights and the wrongs of immunization, and all those myths and beliefs that we have in the past, try to remove them from the mind of our people. They actually have a very good role, and they are performing that role excellently well. Yes.
But how can we technologically drive immunization better?
This is one of.
Okay.
This is your program, this platform, which is very good. It's informing. It's a very informative program. When people get to hear the information firsthand from professionals, then they are able to accept it and they are able to go with it. Then, apart from that, jingles. The Lagos State government is doing a lot with M1 Lagos in engaging, and then Pathfinder as an organization in engaging the community, the stakeholders, to inform them, to tell them the benefits of immunization and how this can help our children. And this has been going on. And so when we continue, at the long run, we'll be able to get to more people who, and the acceptance of immunization and vaccination would increase.
I know the Medical Women Association of Nigeria will be doing a whole lot when all the 36 states of the country, exactly, including FCT,
yes, and
you being a member of Lagos State, which is one of the most vibrant states, will be doing so much with it.
Yes.
What are other successful strategies that we have been able to harness in routine immunization, apart from this professional group like Medical Women's Association of Nigeria?
Going to schools. Like from what we have been able to do at M1 Lagos, we have engaged the district PSAs. We've been to schools, we've informed the students, we've had meetings with the PTA, that's Parents Association of some of the schools, also to be able to disengage, to be able to disseminate this information. And like there are so many programs that have been done to make sure that we reach out to people, and once there is any flag of any vaccination or anything that has to do with immunization, we try to key in and to let people know what is expected of us, of the community, when it comes to immunization and vaccination.
You know, they said one of the buzzwords these days is sustainability. So how do government and the healthcare providers, how do you see that link, you know, that can help in strengthening routine immunization without leaving any child behind?
It is collaboration, partnership. Government workers, government, professionals, NGOs like M1 come together and talk about this and organize programs to be able to disseminate information to people, and then make the vaccine available and accessible to the community free of charge, because that is what is ongoing right now. To be able to maintain that, and so that a lot of people will be able to access and gain from the free immunization program.
So when you look at the demand and supply angle of vaccine, where are we not doing well? Because the demand is there. The children are there. We constantly have under 5. We have the girls between age of 9 to 14. Is supply the issue, or there still some bottlenecks when it comes to the demand end of it? Maybe the sociocultural beliefs and all that.
I would say, from what I know, the demand is the supply is not the issue here.
Okay.
Is the access by, is the willingness of the people to accept and make use of the opportunity that is available. Because I know in my center, there is no time that we don't have vaccine. And it is also almost everywhere, because the PHC board that is mainly in charge of that are doing a great work. So the vaccines are available. It's just for people to come around and make good use of the opportunity.
What is the worst statement you've had when it comes to the myth, when it comes to vaccine? Like, you know, because now we are encouraging our ages 9 to 14 girls to go take this vaccine. What is that thing you heard, like, about this vaccine that you were taken aback? Like, are we still talking this in 2025?
HPV vaccine will cause infertility. Will make our children not to be able to bear children. They want to kill our girls. They don't want our children to be able to bear children. That is not true.
Please speak to these mothers.
It is not true.
Because we know fathers are also part of it, but the mothers.
Yes. Human papilloma virus vaccine is safe. It does not cause infertility in our girls. It will not cause them not to be able to have children. It will not cause them to have any illness. It's not going to cause any disability of any form. It is safe for our girls. Please and please encourage everybody around you, age 9 to 14 years, to take the immunization to prevent cervical cancer, vulvar cancer, uterine cancer, penile cancer, excuse me, and even throat cancer for all our sexually active children and ages 9 to 14 years. Thank you very much.
You've heard it all. I think she has just wrapped it up so beautifully. So if you're a dad or mom, aunt, uncle, concerned Nigerian citizen, a teacher, do know that routine immunization is standard globally, and we need to encourage each and every one of us to make sure that our children receive this immunization, because they are life-changing, they are lifesavers, and we do not want to leave any child behind. Until next time, my name remains Dr. Kadri, and please kindly follow us on all our various social media platforms. And if you want to be here like Dr. Temitayo Ishola, sharing from your wealth of knowledge, or even have a health situation that you want to talk about, or being an health enthusiast, you can be part of it. Just go to our website, fill the form, and you'll be right here. Until next time, remain blessed.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.